Bismillah ar-Rahman ar-Rahim. Today we are going to talk about applied ocular physiology. We will concern in near work and accommodation. Uh, First, we will talk about general anatomy and we will talk about anatomy of the lens and the zonule, especially. All of you know that the outer layer is composed of the sclera and the cornea, and the middle layer is consists of the iris ciliary body and the choroid, and the innermost is the actual retina that contains the photoreceptors. These are three layers of the wall of the globe. Inside this, there is the lens, which is a biconvex, transparent, crystalline structure, has the ability to change its shape. The lens divides this globe into two cavities or segments, anterior and posterior segment. The lens consists of two surfaces, anterior capsule and posterior capsule. In the margin of this surface, there are ciliary body. That attached by zonular fiber to the ciliary body. These zonular ligaments are about 70 zonule are attach the lens into the ciliary muscle. These ciliary muscles are of two types. The meridianal fibers, which extend from the peripheral end of the suspensory ligament to the corneoscleral junction. These fibers, when contract, the lens ligaments are pulled medially towards the edge of the cornea, and so release the ligament tension on the lens. The other fibers or muscle are the circular fibers. These are arranged circularly around the way around the ligament attachment. All of the circle of the eye. When these fibers contract, a sphincter-like effect occurs. This will lead to decrease the diameter of the ligament, and so they will uh, become lesser in the stretch and in tension. Please see here. You will this is the picture for the whole eye. This is the three layers. This is the outer one, the sclera, and here is the cornea, then the choroid, and the innermost is the retina. Here is the lens, which is suspended by the zonular fiber into the ciliary body. In front of the lens is the iris. In the center of the iris is the pupil. Here it is more clear, the zonular fiber and the lens fiber also, and the ciliary body. Now we will talk about the near response and how it occurs and its mechanism. When near object is focused, three events occur simultaneously. These are convergence, accommodation, and pupillary constriction. All of these three events called near response. All of the motor pathway for all of this activity is through the nucleus of the third cranial nerve, oculomotor nerve. Accommodation and meiosis being mediated by autonomic division of this motor nucleus, the Edinger-Weisstein nucleus, of course, along the oculomotor nerve. These two are separate since the reaction may be abolished selectively by appropriate treatment of the nerve or ciliary ganglion. This means they uh, have two different pathways. Or under normal circumstances, most near work is done at a distance of 25 to 40 centimeters. Within this distance, when the non-accommodating eye, that's the emmetropic eye, or if any emmetropia is corrected by spectacle or contact lens, we need 2.5 to 4 diopter of accommodation to see this object clearly. So that when the object is closer than infinity, the usual image construction lead to the formation of the image behind the retina. To focus in this image into the retina clearly requires that to short the focal length, that to bring the image from behind the retina into the retina. So the posterior focus should move anteriorly, that it requires an increase in the dioptric power of the whole system of the eye. The process that increase the refractive power of the eye is called accommodation, and this occurs by the changing the shape of the lens to increase the dioptric power of the eye while focusing on an object. So we define the accommodation by it is the process of changing the shape of the lens to increase the dioptric power of the eye while focusing on an object. During rest, focusing at distant object don't need any power. So when changing from distant to near, these need to increase the focal power to focus to these near objects. The ciliary muscle contract, and when it is contract, the tension in the zonular ligament will decrease, and the lens can move, especially the capsule, can move forward, so that the lens becomes thicker and more convex. This increased curvature will increase the focal power and shift the focal point closer to the eye. In children, the refractive power of the eye lens can be increased voluntarily from 20 to 34. That about 14 diopter by this mechanism. That in children that the shape of the lens can be changed to increase the power of the eye for 10 diopters. Why is that? Or how can this occur? In young people, the lens is composed of a strong elastic capsule. This elastic capsule is filled with viscous protein containing transparent fluid. This is the material of the lens. In the relaxed state, it is almost spherical due to the elastic retraction of the lens capsule. There are about 70 eye suspensory ligaments, as I mentioned before. These are attached around the lens, pulling its edge towards the outer circle of the eyeball. These ligaments are constantly tensed by their attached to the ciliary body, and thus remain relatively flat under normal conditions. Thus, contraction of a smooth muscle in the ciliary muscle relax these ligaments, the zonular ligament, to the lens capsule, and the lens assume a more spherical shape and become more thicker and the refractive power increase. The ciliary muscle contraction is controlled by parasympathetic nervous system. These nerves are supplied to the eye through the cranial nerves series, the third cranial nerve. This is the oculomotor. The sympathetic stimulation relaxes the ciliary muscle, while the parasympathetic contracts the ciliary muscle, so that when an object moves towards your eyes or towards the eyes, parasympathetic impulses sent to the ciliary muscle. With aging, the lens grow larger and thicker and become far less elastic due to denaturation of the lens protein. Thus, the ability of the lens to change shape decreases. The power of accommodation decreases from 14 diopter in a child to less than 2 diopter in about 45 to 50 years, and to zero nearly to zero at about 70 years. The eye can no longer accommodate for both the near and far. This condition is called presbyopia, and it starts at after 40s. In the fifth decade, here, look here, accommodation of the eye, this accommodation of the eye, distant object or near object. Distant near object, ciliary muscle contract, uh, focal length of the lens became thicker, focal length become, while in the distant object, ciliary muscle relax, lens become flatter, focal length of the lens increase. Accommodation in general for near is about 3 to 5 diopter. The percent of the total ciliary muscle force required for near vision is small in the young person, about 5%, even in, in some even less than 5. Because I mentioned before, mm, children don't want to use their accommodation. With age, this percent increase that the eye use the ciliary muscle power or force increasing by 8 until it is reach 100% of all of that the ciliary muscle force will be used all of it with, and this is especially in the presbyopic patient or person. It is likely that the subject is using maximal ciliary muscle power, a condition that might produce eye strain, rendering the use of the spectacle desirable before near vision is impossible. Now we talk about, I mentioned that there is a variable accommodation between relaxation and full contraction. So there is amplitude of accommodation that we define it as it is the difference in refracting power of the eye in the two states of complete relaxation and maximal accommodation. If a person to see single and distinct, the convergence and accommodation must match. By the age of 45, the remaining accommodative amplitude is insufficient to do this. So those near objects are blurred. Even if sufficient accommodative amplitude remain in some instance, the entire remaining amount must be employed, causing fatigue after some time, this or an athenopia, especially during reading. For this reason, there is a variability of accommodative amplitude, but very small. The rate of decline of accommodative amplitude is occurring with very little individual variability, even among heterogeneous or different populations. Although the uniform of the decline across any given population and even within a given individual has been questioned and suspected, but still amplitude of the accommodation is one of the most reliable biomarker of human age known. Now come to the near point of accommodation. The near, it is the nearest distance from the eye at which an object can be brought into sharp focus as an object is moving closer and closer to the eye. At a certain point, this is the near point of accommodation, the eye can no longer increase its dioptric power and the object become unclear, indistinct. While the far point or punctum remotum is defined as that position on the optic axis that allows the formation of clear image on the retina of an accommodated eye. So the problem with age in the lens are of two types, presbyopia and the cataract. Also sometimes there is stigmatic problem occur by aging because of the increasing size of the lens with the age. Presbyopia, the amplitude of accommodation decreases progressively with age following from 14 as I mentioned before to nearly zero at 70 years. Thank you and see you next time. This is a lecture or a small talk to my student to see all of the around the world. Bye.